Okay. We are starting the meeting now. So welcome to the third webinar of the webinar series, How Do We End Malaria in Africa? It is hosted by Health Tech Platform, an initiative of AFIDEP. The webinar series is focused on how to end malaria in Africa and the effectiveness of some of the interventions. The first webinar focused on how to reduce the burden. The second one looked at the threats to ending malaria. And the third webinar today will be looking at what African countries can do to ensure investments and sustainable financing mechanisms for malaria elimination. My name is Ojoma Ako, Health Editor, Daily Trust Newspaper, Nigeria. I am also the winner of the print category of the Emerging Health Technologies Award, which was organized by Health Tech Platform of AFIDEP. So today we have experts who will be speaking on this topic. Our keynote speaker is Dr. Perpetual Uhomoibi, the National Coordinator of the National Malaria Elimination Program, Federal Ministry of Health, Nigeria. She'll be talking about the Nigeria context of the topic. Can Dr. Perpetua put on her video so we...
Hello, my video is on.
Okay,
my video is on.
So Dr. Perpetual has over 20 years experience in public health with a bias in research, monitoring, and evaluation. So as the national coordinator of the NMEP in Nigeria, she also serves as the secretary of the Nigeria End Malaria Council. She has also co-authored several scientific publications. Welcome, Dr. Perpetual.
Thank you very much. I'm honored to be here.
Okay, so we also have panelists. We also have panelists who will be speaking on various ways in sustainable financing for malaria elimination on the continent. We have Dr. Temba Zilahowa. I hope I get that correct. Dr. Temba Zilahowa. He's a senior entomologist at the Malaria Action Center, Malawi College of Medicine. He has worked on Anopheles vector mosquitoes of malaria and lymphatic filariasis in Malawi. He is active in various malaria technical committees in Malawi and as an in-country president's malaria initiative entomologist. We also have, can we say hi to Dr. Temba if he's online?
Hello, that's me.
Okay.
Thank you.
Nice to have you here, Dr. Temba.
Thank you so much. It's an honor.
All right. Then we also have Ambassador Odinaka Kingsley Obeta, West African lead, ALMA Youth Advisory Council. He is a trained and licensed biomedical scientist and a public health enthusiast with experience in health communication, youth development, policy development, and advocacy in global health. He's also the executive director of Block Malaria Africa Initiative. And among others, he was an international observer at the 72nd WHO Regional Committee meeting in Togo. Welcome, Ambassador Obeta.
Thank you so much, Ojoma. It's a pleasure to be on the call this afternoon, and I'm looking forward to the exciting conversation with the great experts and colleagues on the call. Thank you.
Thank you, Dr. Obeta. So we also have John Tanko Bawal, Chief of Party, PART Ghana, and Director, Malaria Vaccine Implementation and Expansion. Is Dr. Bawal on the call?
Yes, please, I'm here.
All
Thanks
right.
for the opportunity. I look forward to an excited conversation.
Thank you very much. We're all happy to have you here. Then another panelist. Sorry, we have another, the other panelist is what kind of?
I could speak on that, Ojoma. Dr. Donny sent his apologies that he's unable to attend due to an emergency, but he would have loved to be here, and he hopes next time we would be able to join and meet all of us. But unfortunately, he's unable to join. Thank you.
Okay, so may I now invite Dr. Perpetua Mohibi to speak on what African countries should do to ensure investment and sustainable financing mechanisms for malaria elimination.
Okay, thank you, Ms. Ojoma Akor, the moderator, and good afternoon, everyone. And I'm honored to be invited to give the keynote speech at this webinar on what African countries can do to ensure investment and sustainable countries. As a brief background, we all know that malaria remains a major cause of death and morbidity in most African countries. Although the disease is preventable, is treatable, and is curable. From the World Malaria Report of 2022, which is last year, it is estimated that African regions account for an estimated 234 million cases of malaria as at 2021, which was about 96% of the total global burden of malaria. It's also important to note that 29 countries accounted for 96% of malaria cases globally, and 4 countries, Nigeria, Democratic Republic of Congo, Uganda, and Mozambique, accounted for almost half of all cases, contributing 27% in the case of Nigeria, 12% in the case of DRC, 5% for Uganda, and 4% for Mozambique in 2021. I must also add that over the years, there are few African countries that have achieved massive reduction in malaria burden, and they're almost at pre-elimination level. For reported 0 indigenous cases for 3 consecutive years in 2021, ending the malaria malaria epidemic in Cabo Verde. In terms of malaria deaths, the 2022 World Malaria Report reveals that about 96% of malaria deaths globally were in 29 countries. And the 4 countries that accounted for most of this were Nigeria, 32% of all global deaths, DRC, 13%, Niger, 4%, and United Republic of Tanzania at 4% also. We can see that African countries account for over 96% of global malaria deaths. These statistics, you agree with me, are very alarming, and we need to do much more than we are doing currently to achieve malaria elimination in the African continent. Malaria tends to take its greatest toll on vulnerable children under the age of 5 years, as well as pregnant women in these developing countries, particularly in Africa. And it is seen also as a developmental challenge beyond its devastating public health impact. We also know that malaria has an adverse effect on economies in most of these African countries where it remains endemic. And it contributes to high socioeconomic losses and reduced productivity through absenteeism from work, from schools, from markets and farms, as well as reducing the economic power of families as a result of high out-of-pocket expenditure on repeated diagnosis and treatment of malaria over the years, as well as income loss from parents who have to sit at home to take care of their sick children every time they have an episode of malaria. To tackle the scourge of malaria, affected countries have adopted strategies over the years that include impactful interventions such as vector control to reduce mosquito populations and man-mosquito contact, thereby reducing malaria transmission. These include the use of indoor residual spraying, larval source management, and environmental sanitation. Other interventions that are being deployed at large scale include the use of chemoprevention for malaria in young children, which is called seasonal malaria chemoprevention, as well as intermittent preventive treatment of malaria in pregnant women. And then the recently converted perennial malaria chemoprevention, which used to be intermittent preventive treatment in infancy. Also, these are targeting special population groups like pregnant women, and then for the PMC, children, young children. This, together with prompt diagnosis and treatment services, have helped countries to achieve reduction in malaria morbidity and mortality over the years. But we know that these interventions are very, very costly, and they demand a lot of resources by government and donor respectively. The implementation of the high burden, high impact approach, which was launched by WHO in 2018, has also led to some significant reduction in malaria burden. For instance, 5 out of the 11 high burden, high impact countries, that is the DRC, Ghana, India, Niger, and Tanzania, showed a decline in malaria deaths, although their contribution to the malaria burden within the high burden, high impact country is still substantial. Now, looking at the investments in malaria elimination, according to the World Malaria Report 2022, the total funding for malaria control and elimination in 2021 was estimated at about $3.5 billion US, compared with $3.3 billion in 2022 and $3 billion in 2019. So we see that the investments have gradually increased. The amount invested in 2021 fell short of the 7.3 billion that was estimated by WHO to be required to stay on track toward meeting the global technical strategy milestones. We know that WHO developed that. With their countries are expected at least 90% reduction in burden and deaths of malaria by 2030. And so you will see that the amount that has been computed that we need for the 2021 was about 7.3 billion US dollars, but only about 3.5 billion was actually spent. So there's a huge gap between what is required in terms of resources and what is actually being expended. The funding gap between the amount invested and the resources that are needed has continued to widen dramatically over recent years, increasing from 2.6 billion in 2019 to 3.5 billion in 2020 and about 3.8 billion in 2021. We see the gap is almost about half the resources that are available that are being used. Over the period, that's between 2010 and 2021, about 10 years, 67% of the total funding for malaria control and elimination, that's about 2.4 billion US dollars, stemmed from international sources, such as the United States government, donating over 1.3 billion US dollars. over that 10, 11 years period. United Kingdom and Germany contributing about 0.2 billion US dollars, and contributions of about 0.1 billion from Canada, France, and Japan, and combined a contribution of about 0.4 billion from other countries that are members of the Development Association Committee and from private sector contributors. Now, the government of malaria-endemic countries contributed more than a third of the total funding in 2021 with investments of over 1.1 billion US dollars, of which over 0.3 billion was spent sector and 0.8 billion on other malaria control intervention, which increased by about 0.1 billion from 2020. So we see that most of these investments and resources that are being plowed into the malaria program is largely on malaria prevention, and the malaria case management, that is diagnosis and treatment, as well as preventive services such as the use of insecticide-treated nets and other similar interventions. Now, the summary of all this is that most of the malaria-endemic countries, and which are largely within the African region, the funding that is being used for malaria is largely donor dependent from the statistics I've given. Whereas the country contributed about 1.1 billion, donor investments were over 3 billion. And for us to achieve sustainability in malaria funding towards reaching elimination, what then do we need to do to bridge that gap, to even have enough resources, that we need to achieve the global technical strategies by 2030, by achieving over 90% reduction in malaria cases and deaths in all the malaria-endemic countries. Now, what are some of the proposed investments and sustainable financing for malaria control that we need? African countries, the malaria-endemic countries, of course, which is also largely African countries, must ensure that the existing financial mechanisms are well maintained and strengthened. So existing platforms for donor funds like the Global Fund to Fight AIDS, Tuberculosis, and Malaria, the World Bank, the Present Malaria Initiative of the US government should be properly managed following set guidelines. There should be greater advocacy to ensure that the Global Fund and other existing donor platforms continue to provide support to African countries. Collaborate with other government donors, both existing bilateral donors, such as the governments that I mentioned earlier, Australia, Canadian government, Japanese government, UK government, and others, France and others, that will maintain and encourage them, that will continue to encourage them to maintain and expand their commitment to funding malaria elimination. And there's also a need to set up regional funds for malaria elimination, such as the Malaria Elimination Fund for Africa, MEFA, which could be managed by the African Development Bank for long-term control and prevention of malaria in this continent. The region has some fast-growing economies that might be willing to contribute to this fund. There are already existing several regional cooperatives or groupings like the Economic Community for West Africa, ECOWAS, the South African Development Community, SADC, the East African Development Committee, and the Arab Maghreb Union. These are some existing communities that can be encouraged and advocated to begin to fund malaria if they are not already doing so, or increase their funding for malaria. The African Leaders Malaria Alliance, the End Malaria Council initiative, which is driven by the African Leaders Malaria Alliance, should ensure that endemic African countries continue to push for malaria funding to remain high on political agendas of governments, so that governments, are able to put in more resources within their budgetary allocations for malaria prevention and control towards achieving elimination, and to build a strong public-private partnership to support domestic resource mobilization for malaria in their different countries. Because we know, of course, that government funding alone cannot do it, because there are competing challenges and needs for the countries, But African countries also enjoy a robust private sector organizations that the government and the malaria programs can, strengthen that public-private partnership, public-private philanthropic partnership, and that some of these may not necessarily be just philanthropic, but we'll see how they can invest. So they see malaria control as a business case in which they can invest in malaria health products, whether it's nets, whether it's, anti-malarials, ACTs, the MRDTs, and other medications like the preventive treatment for malaria in pregnancy and all that, because we see that most of these commodities are being imported because very few of the African countries have WHO pre-qualification for some of these health products, malaria health products. But we need to ensure that the public and the private sector are working collaboratively to see how we can strengthen local manufacturing of these commodities within the African subcontinent. So I know that a pharmaceutical company in Kenya was recently acquired the WHO pre-qualification for manufacturing of sulfadoxine pyrimethamine for prevention of malaria in pregnancy. But we need more. We have a huge market for these commodities. So we need more African countries to be able to attain, that pre-qualification. If we see what happened in the Southeast and other countries, some of these products, the government took it as a case for them to strengthen, support through loans or investing, in this, so that these countries can reach the standard of meeting those good manufacturing practice, as well as WHO pre-qualification, so that some of these, when these products are manufactured locally, then of course we have we don't have to depend so much on importation. We will increase investment in terms of employment and capital within these economies, strengthen the economies of these countries when these health products are also produced, and create jobs for the people, and be able to reduce some of these importation costs that accrue when these products are largely being imported. So there should be more private-public sector collaboration in terms of malaria healthcare products, investing in malaria healthcare products. And then other funds, other sources of contributions from direct, traditional direct contribution from bilateral and multilateral donors should be encouraged and strengthened, and then governments of these malaria-endemic countries can seek loans from the World Bank, Islamic Bank, African Development Bank, just as in case of Nigeria. So what happened that our main malaria donors are the Global Fund and then the President Malaria Initiative of the US government. But then we found that we still had a gap. So in order for the government to meet some of these gaps, the government had to request a credit facility from the World Bank and Islamic Development Bank to the tune of over $300 million to be able to cover those states that didn't have funding from these two major donors. So we got this credit facility approved, and which the government will have to pay back over a period of time, just to ensure that we are able to maintain our interventions with full coverage, over the country, based on our strategic plan that we want to ensure at least 80% coverage of all these major interventions I had mentioned earlier, to ensure that we needed to take this loan from these banks, this credit facility from these banks. Also, market financing and debt raising mechanisms can be considered if international financing facilities, social impact, and paper for performance bonds can be taken by governments of these malaria-endemic countries. Debt conversion schemes, such as the debt to health scheme of the Global Fund, can be assessed by countries. Endowment funds can also be assessed, such as the Rockefeller Foundation, which was set up as an endowment fund with an initial contribution of over $100 million US. International earmarked taxes, like the solidarity tax on airline tickets, can be used to fund malaria interventions, And the regional funds like the Inter-American Development Bank Regional Fund for Agricultural Technology and the Gulf Cooperation Council Malaria Control Fund. These are some of potential sources for, getting more funding for malaria. Other potential new sources of funding for health may include the private sector foundations, which I mentioned earlier, individual philanthropy. For instance, we in Nigeria, our End Malaria Council is a public-private sector partnership. So we have people, parliamentarians who are responsible for government, resource budgetary allocation to governments, so that government can increase its funding for malaria, as well as the private sector. Of course, the Malaria Council, End Malaria Council in Nigeria is chaired by Alhaji Dangote Foundation, the chair of the president and chair, who is Alhaji Dangote himself. Of course, we know that he's a very rich private sector person in Nigeria, and he recently just opened the largest refinery in Africa, in the African region, I think. And so we are hoping that he's going to bring in some of that into strengthening advocacy, accountability, and resource mobilization for malaria control in Nigeria. So there are other foundations like that exist in different countries. So the malaria programs and the ministries of health should look for some of these to invest more in malaria control. And then we also have other philanthropic contributions from individuals and other government donors, and other steps that can be used to reduce costs in the long run may include things like pool procurement mechanism for supply chain for procurement of malaria commodities to reduce the cost, and pooling and management of funds, in countries, malaria programs and countries, and then specification of benefits, such as prioritization of interventions by greatest needs and impact. So we know that malaria, it's not a disease that is equally distributed even in countries, within countries. Like Nigeria is very heterogeneous, the transmission is heterogeneous. So you have states that have a burden of less than 2% prevalence, in a way they're already almost in pre-elimination, whereas you have other states that have over 50% prevalence in terms of children under 5 when we do our surveys. So you cannot use the same intervention. You cannot distribute nets widely to everybody. So you prioritize. That's why WHO is emphasizing subnational tailoring of interventions. So for targeting greatest needs, and of course, addressing the issue of equity. So you give to those that need it, the highly vulnerable groups, the children under 5, the pregnant women, communities living in underserved and unprovided for communities, and hard to reach areas. Make sure that they are well reached with malaria intervention. And then those living in urban areas that can afford these medications, this intervention, whether it's for prevention, let them pay for it. So there should be, there shouldn't be equal intervention. So you prioritize by greatest needs and equity and greatest impact. What are the low-hanging fruits that you can do, what you can invest in, that you can get quick impact. So we need to reprioritize our interventions, and then also support other fund mobilization schemes, such as the establishment of the End Malaria Council, of course, which I said that the African Leaders Malaria Alliance is promoting across countries and supporting, and which Nigeria also launched last year. And other taxes, such as the alcohol, tobacco, beverage tax. And then for Nigeria in particular, the government, this current government, also approved and launched the Basic Healthcare Provision Fund, which is actually at least in which the government allocates at least 1% of the revenue, consolidated government revenue, into primary healthcare, which of course, malaria is one of the package of intervention that's being supported under this Basic Healthcare Provision Fund. And this fund is available for all the states to key into to provide these services for malaria, among other maternal and child health interventions, at the primary healthcare level to reduce infant mortality and morbidity, and also maternal mortality and morbidity. So in conclusion, malaria elimination requires sustainable financing for most endemic countries. And this can only be achieved if countries and the global community commit to ensuring sustainable financing through innovative sources that may be internally generated or from external donor support. Thank you.
Thank you very much, Ma, for that in-depth outline on how endemic countries can really sustain financing for malaria elimination, as well as the continent as a whole. Thank you, Ma. Some of the highlights of the keynotes and some resonating points throughout is that there is a huge gap between what is required for malaria elimination and what is being allocated. There is also the fact that there's major dependence on international funding. Dr. Perpetua also outlined several ways we can invest as well as sustain financing. And one key point was regional funding mechanism for long-term control and elimination. And then there's need to strengthen financial mechanisms that are already in existence. And then there's also the need for innovative financing and leveraging on taxes and PPE collaboration. And without commitment, we cannot achieve all this, she ended. Thank you very much, Dr. Perpetua, for those points. So for the audience, we'll still give room for questions and answers after the panelists have spoken. So you can put your questions on the chat box, and we'll also allow you to ask after the panelists have spoken. So we'll now be moving to the panelists, and we have some questions, but they'll be answered by Dr. Perpetual after the panel session. So may I invite Dr. Temba to give us to talk about the gap in resources required to run the infrastructure that he has been playing critical roles in Malawi. So what he would talk about the extent of the gap and also suggest solutions. So over to you, Dr. Temba.
Thank you so much. I would say I'm humbled after the intro from Perpetual, because it was really, really comprehensive. So I would delve into possibly local scenarios, and I'll come in with the Malawi example. So what Perpetual has just said is malaria control, malaria treatment is hugely dependent on the donor. I was privileged that on the 3rd of May, I participated in the malaria operational planning for PMI, and it was very clear from there that budgets, there is funding cuts. So if you are dependent on a donor, and it's a fact that you cannot build a house depending on your sister who is either working at WHO or in the government, you have to build your own house. That's a fact. We should accept that. The second thing is we should also accept that for important engagements like these, maybe in future, we should also include to make sure that our program managers at national level, they should be here to participate fully. Where are the challenges? So it's one thing to talk about malaria, and then if you ask or delve down into the national programs to ask whether there is a business plan and an investment plan for malaria, these things are not there. So that already creates a challenge. So until we create or we develop, so it's very easy to develop a strategic plan for malaria control, malaria elimination, but we should also make sure that we develop the business and investment plan to accompany the implementation of the strategies that we have. And most of these strategies, they'll be very silent on local funding, local resource mobilization, and yet there are so many opportunities that are out there. A good example is what, again, Perpetua has already looked at, issues of levies, issues of pension funds, some of them that are very idle. We don't know how to tap into those things. In Malawi, for example, we have a huge trust, which is national trust, called the Press Trust. I've not heard of anything happening or approaching those trusts to ensure that there is investment in malaria control and malaria elimination. So there is a need for political engagement, both at parliamentary, but also the business partners who are there, or business champions that are out there. But also, before we can do that, we should also realize that there are also threats. One emergent threat at the moment that is going to affect malaria elimination for the next 5 years is possibly the destabilization that we're seeing in Ukraine. Have we considered that? What will be the impact? We talked of COVID, possibly that has never been touched on. So funding for malaria elimination, I think there will be a huge threat to that. Therefore, dependence or over-dependence on the international community, i.e. PMI and Global Fund, should be, yes, be welcomed, protected, but the more we come to internal resource mobilization with clear business plans, clear investment plans, and clear capacity building capabilities, this war against malaria or elimination may elude us, because currently most of the malaria strategic plans, they're looking at malaria control, malaria elimination by 2030, at whatever level they are. Are we realistic? What sort of resources do we need? Do we have those resources now, or do we hope we're going to get those resources by 2027? Is it possible? So I am very excited that we're starting these conversations, but let's not forget to engage the program directors, because it's the program directors who literally know that where are the gaps, what sort of strategies should be developed besides the strategic plan themselves. I think for now, this is where I should stop. Thank you so much.
Thank you, Dr. Temba. The Russian-Ukrainian war is a threat to malaria elimination in the next 5 years. This is something to be looked into. And then you talked about the need to look into domestic resource mobilization. Thank you very much, Dr. Temba. For our audience, we still maintain you keep your questions coming. We'll still entertain them. So we now move to John Tanko Bawa.
Okay.
Yeah, you have extensive experience leading malarial vaccine implementation and expansion in Africa. So you will be giving us an overview of the nature of Gavi financing for vaccines, among others. Thank you, over to you.
Thank you, moderator. And also thank you to the keynote speaker and Dr. Temba. I think you provided a comprehensive overview of the malaria landscape. Yes, so I think it's quite interesting that I need to add that over the last few years, one other malaria intervention that has brought some excitement within the African continent has been the malaria vaccine. As most of you might know, the malaria vaccine was approved by WHO for worldwide use in areas of moderate to high endemic malaria in 2021, following the review of data from the ongoing pilot in 3 countries currently, Ghana, Malawi, and Kenya. Now, this vaccine already is in the routine settings of these 3 countries through a phased introduction approach led by the ministries of health in these countries. And PATH has been honored to serve as a partner in this phased introduction, which has already delivered 4.5 million doses of malaria vaccine to nearly 1.5 million children since vaccination began in 2019 in these countries. Data generated by the 3 countries has shown high community demand for the vaccine, that delivery of the vaccine is feasible, and the vaccine safety in routine settings has been confirmed. In the areas where the vaccine is being deployed, vaccination has significantly reduced life-threatening severe malaria. So the RTSS malaria vaccine is actually currently the first malaria vaccine to be approved by WHO, and currently is the only one that is currently being used by these 3 countries within these wide settings. And Gavi has now also brought on board new countries to begin the use of the vaccine as an additional intervention tool to the existing interventions that Dr. Perpetua mentioned in order to accelerate the pace at which the malaria fight is being fought on. Now, Gavi, the Vaccine Alliance, is going to be the primary source, has been the primary source of vaccine financing in Sub-Saharan Africa, specifically for countries that are Gavi eligible. And so it is no wonder that the Gavi board approved the malaria vaccine to be included in its portfolio of vaccines. However, eligibility for Gavi support is based upon national income per capita to help ensure that support goes to the lowest income countries. And so countries would naturally fall into one of 4 categories depending on their national income. First is initial self-financing, preparatory transition stage, accelerated transition, or fully self-financing. As of December 2022, after the Gavi meeting, the Gavi board approved an exceptional time-limited approach for malaria vaccine co-financing to facilitate affordability and support uptake. This improved the affordability of the vaccine for all Gavi eligible countries. But for purposes of those who probably might not be very much averse with this financing categorization, for initial self-financing, countries would normally contribute about 20 cents per dose to every vaccine that Gavi would supply to them. So countries are expected to make that kind of contribution if we are in an initial self-financing. For those in the preparatory transition stages, countries co-financing starts at 20 cents per dose in the first year of introduction, and the price fraction increases by 15% annually. For those in accelerated transition like Ghana, Kenya, and I think Nigeria, these countries would contribute 20% of the price fraction in the first year of introduction and increases co-financing by 10 percentage points annually. This results in a slower transition period over 8 years instead of 5 years, in keeping with the Gavi board decision in December. For countries that are not Gavi eligible at all, or who are in accelerated transition, sustaining vaccination programs may be challenging, in part because of the public funding for health programs is typically a small fraction of countries' national income. According to the WHO, most African countries spend on average about 5% of national income on health in general. The government funding is able to cover only about 40% of that expenditure on average. And so it is no wonder that, as Dr. Perpetua indicated, majority of the funding that comes into the health sector and into the malaria setting in particular is all donor dependent. So for example, government expenditure as a percentage of total health spending was about 42% in Angola in 2022, 55% in Gabon, 50% in Ghana, and 47% in Kenya, whilst in Nigeria and DRC, it was 15% and 16% respectively. Thankfully, childhood immunization programs are prioritized by most country governments. However, with more expensive vaccines, this may become more challenging, except for the wealthiest of countries. There are other sources of financing for immunization programs that may be accessible for countries that are graduating from the Gavi support. Of course, discussions are ongoing to look at possibilities of a mixed funding regime where private health financing and insurance schemes could also become an option, where probably we know that in most parts of Africa, and especially in the urban areas, we currently are having some population that are tended to use private health insurance schemes. And these schemes are normally also supported by corporate institutions to support their staff and employees. And so to what extent could these sources be leveraged so that those categories of the population that are accessing healthcare services through these schemes could also be supported with the funding that is required for the requirement of the vaccine needs through that approach. Other donors may have funds available, especially to help with immunization programs. The World Bank and its International Development Association can provide loans and grants to support. We also saw that the African Union, through the African CDC, was able to work and coordinate with a lot of countries to pool resources to be able to ensure that the COVID-19 vaccines, especially the Johnson & Johnson ones, became quite available and accessible to most African countries to complement the efforts that came from the COVAX platform. I think they were able to, most countries were able to work around with World Bank to be able to secure some special resources to be able to support that. To what extent can we make sure that these efforts can be leveraged to support the malaria vaccine availability to complement the existing malaria interventions to be able to accelerate the pace of elimination? There's also currently a renewed effort of building African manufacturing capabilities. Already we are aware that about 99% of the vaccines that we use in Africa are all imported. So to what extent can we reduce the import dependence? Can we build capacities in Africa to be able to make sure that the benefits that comes out of local production and then the pooled procurement that will be done by a lot of African countries for these vaccines that will be manufactured here will be able to bring the benefits that are required in terms of the cost savings that would arise. Then also, there is a need for us to build a lot of synergies and reduce inefficiencies in the context of universal health coverage and primary health care intervention by avoiding the duplication that arises from parallel implementation of related programs in African countries. Many a times, malaria programs might have their resources using a different vehicle for their deployment. Immunization might have similar resources, but they are all interfacing at the same level, at the same community level, working with the same community health nurses. To what extent can we make sure that inefficiencies and duplications are avoided so that we can be able to minimize the cost of having these social interventions implemented? And let's not also forget that the private sector stands to benefit from improved healthcare among children for its employees. So how do we ensure that all the efforts that was made, all the interest that was generated when COVID-19 was at its peak, where the corporate sector in Africa and other parts of the world became very much interested in vaccination and public health interventions in general, how do we sustain that? I know that my other colleagues have talked about taxation and others. I know in Ghana, the government introduced the COVID-19 tax, for instance. To what extent can this be repurposed to support public health interventions in general and malaria vaccines in particular? Finally, I also want you to know that there is another malaria vaccine that is in the horizon, that's the R21, which currently has received some regulatory approval in at least Nigeria and Ghana. It is currently undergoing WHO review, and if WHO also makes a decision and pre-qualifies it, it is likely that Gavi would also include it in its malaria portfolio. And so what that would mean is that apart from the RTSS malaria vaccine, which is currently available and pre-qualified and it's available for countries to access, we could also have another malaria vaccine becoming available. What that means is that the tools that are going to be available are all going to be, there will be more tools that are available to complement the existing interventions. And we believe that with all these renewed efforts, probably costs might go down, and also we should be able to accelerate the efforts at getting malaria out of the continent. Thank you very much for your attention.
Thank you very much for that explanation on how countries can harness Gavi financing for vaccines and the current status of malaria vaccine. You also harped on the need for synergy as well as reducing importation and strengthening local vaccine production capacity. Thank you for that, John Sanko power. So we'll now move to Ambassador Odinaka Kingsley Obeta, who will be giving us an overview of youth participation in advocacy for malaria control and elimination at continental, regional, and national levels. Mr. Obeta, please.
Yes, thank you so much, Ms. Ujoma. Actually, listening in from the keynote from, given by the #1 malaria champion in Nigeria, Dr. Perpetua, I was just excited following through with the breakdown, and then having Dr. John as well, give up by saying that we can all agree that advocacy plays a crucial role in increasing and sustaining investment. Is a key thing to note, right? Now, advocacy involves raising awareness, mobilizing support, influencing decision makers, prioritizing malaria funding, and a whole lot of others. The question we have is, why is it important for youth voice actually to be captured when it comes to conversations around sustainability? I want to start by saying that, the first point I'll be giving is generating political will. Advocacy efforts can generate political, and the importance of investing in its prevention, treatment, and research. Now, by engaging policymakers and key stakeholders, young people or youth can shape policy agendas and secure commitment for increased domestic funding, which is what we've been discussing countries to begin to, generate domestic funding for malaria intervention, so that we can on donor funding. Now, let's look at raising awareness as also another key point. Advocacy campaigns can educate the public and policymakers about the impact of malaria on individuals. And by highlighting the burden of the disease and its potential for prevention and elimination, advocacy efforts can also help to mobilize public support, create increased investment. Resource mobilization is another very key point on why advocacy is important for, sustainable investment for malaria. Advocacy helps to attract the right financial resources by showcasing the burden of malaria on individuals, on communities, and economies, right? And by highlighting the burden of this disease, it also gives us the potential to also see that malaria elimination is possible, right? Now, I want to say that sustain is not enough to raise funding. We know we all for us to sustain funding. So advocacy is not only about securing initial investment, but also about maintaining sustained funding over time. It involves keeping malaria on the political and public agenda and ensuring that funding commitments are fulfilled and adapting strategies to evolve challenges, right? To evolving challenges. And we can see this coming up even from the, the recently concluded 7th Global Fund replenishment, where there was a lot of commitments from private stakeholders and even government and all that. Now, advocacy helps us to sustain, the funding, and it ensures that some of these commitments, are fulfilled by those who have made them. I want to go straight into discussing, why it is important for youth, to be carried along when it comes to malaria advocacy. The first point I'll be giving here, for the sake of our conversation, is that young people inclusion in the fight against malaria leads to fresh perspective and innovative solutions. And this is a point I know our panelists are going to really take very serious, my fellow panelists, right? As well as our participants. The youth bring unique perspective and innovation ideas and energy to the table. They can think creatively, they can leverage technology and social media like we've witnessed over the past 3 years to raise awareness and engage broader audiences, with the fight against malaria. Their involvement in the fight against malaria can lead to innovative approaches, improved communication strategies, and also help to generate new solutions that can help to tackle malaria. Another point is the concept of mobilizing their peers. We know that Africa has about 60 to 67% young population. Now, that is a huge number of people looking at the entire population of Africa. The youth can effectively mobilize their peers and communities to take action against malaria. They can use their social networks, their digital platforms, and communication skills to disseminate information and also organize events and advocate for increased investment in malaria control. We saw this even happening in the World Malaria Day that was just concluded in April. In Kenya, for instance, the Kenyan Malaria Youth Army, which is the component of youth program that is helping to fight malaria in Kenya, had organized what will be the biggest malaria event hosted by young people in Africa, in Kenya. And that led to a lot of successes in the course of that event, right? Awareness on malaria was carried out. Then right now, the same youth are contributing towards, the implementation of increased uptake for malaria vaccine in Kenya. Now, another point is a future-focused advocacy. We are looking at the concept of not just having advocacy to happen today. If we're going to have sustainable financing for malaria programs or malaria intervention, then we need to start looking at future-focused advocacy. Now, as future leaders and inheritors of the world's challenges, my generation of young people, or my generation, for instance, are the ones who are going to be taking up the interventions for malaria going forward after, the likes of Dr. John, Dr. Perpetua, and a whole lot of others. So, as future leaders and the inheritors of the world's challenges, young people have a long-term stake in addressing malaria, right? By involving youth in advocacy efforts, our concerns and aspirations can be greater and can be better included in policy decisions, right? Now, this helps to ensure that the fight against malaria remains relevant even in years to come. We've been making a lot of effort to combat malaria over the past how many decades now? One of the reasons why we're saying that malaria needs to remain on the agenda is because despite the increased investment, despite the effort that is being made, we're still seeing a lot of challenges and barriers affecting malaria intervention in the continent, right? Now, young people have a powerful voice in the society. It doesn't matter which country in Africa you're from. You would agree with me that young people in every country in Africa have a very large voice and a powerful voice, which can attract attention to important issues. Their engagement in advocacy efforts can draw media coverages, right? Influence public decisions and opinions, and then put pressure on decision makers to prioritize malaria funding. So why should we not include them when we are having conversations on discussions like this, right? Now, we also need to start targeting the concept of building intergenerational partnership. It's not, if we're really going to sustain investment, then we need to start looking at, building intergenerational partnership. Now, the inclusion of youth or young people in malaria advocacy promotes intergenerational partnership. It fosters collaboration and also promotes knowledge exchange, right? It allows for the transfer of experience and expertise from the older generation while benefiting from the fresh perspective and insight of the youth. Such collaborations can lead to more comprehensive and impactful strategies. I would say that advocacy is crucial for increasing and sustaining investment and financing for malaria control. If we're going to make a very tangible effort in this regard, then including youth voices in malaria advocacy not only strengthens the advocacy efforts, but also ensures that the fight against malaria remains relevant, sustainable, and responsive to the needs of future generations. In conclusion, I would just want to point this out. Last year, the Commonwealth Youth Forum held in Kigali, Rwanda, and myself and a couple of colleagues from the Alma Youth Advisory Council were present in that meeting. The Commonwealth Youth Health Network was mandated with a task to come up with 3 priority areas that the Commonwealth Head of Government is going to prioritize in terms of funding at the Commonwealth level. I remember how a lot of effort was done, a lot of lobbying and negotiation was done by youth advocates representing different or promoting different health causes, right? And then they had to do a lot of lobbying, a lot of negotiation with other young people coming from different parts of Africa in order to see to it that malaria is added as part of the 3 top agendas that is going to be prioritized by the Commonwealth. I know how many meetings was held, and this was all a young people business, right? From morning down to afternoon, down to the night of that meeting, we were busy having multiple meetings, advocating here and there and lobbying between ourselves to have more young people understand the need for malaria elimination in Africa and then get them to vote for malaria to be added to the agenda. And let me give you the good news. We succeeded in making this happen because malaria happened to be the number 3 item that was added on that agenda. So if you are talking about why it is important for young people to be added, on the agenda for malaria elimination, or why young people should be added on the agenda for, increased investment in malaria elimination across Africa, I can give you so many practical examples on, and it just has to happen. You know, so, and just to give you a highlight, the African Leaders Malaria Alliance, for instance, through the Youth Advisory Council, have made a deliberate effort to recognize the effort and commitment of young people in Africa to the fight against malaria. And to this effort have also created platforms to help equip young people in Africa with knowledge that is going to help them contribute towards the fight against malaria. So far, we have about 48 malaria youth army, national malaria youth armies across 48 countries in Africa. And about 4 countries have already launched the youth malaria, national malaria youth army in their respective countries, including Kenya, Zambia, and even most recently, we have Mozambique added to that list. So we now have a group of young people, totaling close to 100, we have them in hundreds in different countries, who are very passionate about malaria, who are very committed to the fight against malaria, and they who are already doing so much to, advocate for increased sustainable investment or financing in the fight against malaria. We're hoping that countries like Nigeria, countries like Ghana, and a few other countries, Uganda and the rest, that are currently being prioritized at ALMA level for launch, is going to be paid attention to at this point by their respective government, so that we can have these youth armies launched in the countries, and then these youth armies can begin to also support the elimination efforts, and also begin to use the various skills, talents, and opportunities that they have to advocate for malaria elimination in their countries and for sustainable investment in the fight against malaria. So thank you so much for the opportunity. I'll be right here and then following up with other contributions from the other panelists, and the questions that will be coming forth over. Thank you so much, Ms. Ojoma.
Thanks, Obeta. The need for youth inclusion in advocacy. You mentioned future-focused advocacy, since youths will be the ones to inherit whatever investments or mechanisms will be put in place. Thanks for those key points. So we'll be moving to the Q&A, and we'll start with the questions in the box before moving to the rest of the audience. We'll start with the first questions from Luana Kamanga. I think if Dr. Perpetual can help answer that question. The question is, are there other countries in Africa that have recently increased domestic funding for health, especially for malaria control and elimination? Dr. Perpetual.
Okay, like I mentioned, Nigeria had to take a loan, from the World Bank and Islamic Bank, $200 million from the World Bank, and $100 million from the Islamic Development Bank to fund malaria. So that's a loan, and which we have to pay back. So in a way, it is it's not a donor, it's not a donation, it's not a grant, it's a loan. So it is that is an example I can give, because the government is expected to pay back that money. So it is government increases its funding for malaria. But I'm sure there are other African countries that equally, increase domestic resources for malaria. I cannot quote categorically because I don't have the data. But like I said, beyond even the loan we took specifically for malaria, the government of Nigeria also has this basic healthcare provision fund that targets, increased funding for primary healthcare. And malaria is one of the interventions that we know that, particularly malaria case management, diagnosis and treatment services, which is provided free in public health facilities, in the primary healthcare facilities under this basic healthcare provision fund.
Okay. Thank you very much. So the second question will be answered by Dr. Temba. The question is, considering resource scarcity as alluded to by the panelists, why should African countries invest in malaria and not in TB or other deadly diseases?
Yeah, so it's an interesting question. So basically, the reason we talk of malaria, because this is the subject matter. But this does not forsake the other diseases. So when we talk of mobilization, it means we are talking of resources against diseases of poverty among our communities. So, but it's just because of this, what we've selected here is talking about, it's about malaria. So if you're looking at a global fund, for example, it is not just looking at malaria, it's looking at other infectious diseases as well. So meaning that our Ministry of Health, our governments should be looking at these things comprehensively. But as panelists, we were only asked to talk about malaria. So that's why maybe the emphasis is on malaria. But I would say for governments and the Ministry of Health, we should be looking at these things comprehensively. And that's why most of the government, for example, Malawi, we're talking of the swap, so that all resources towards all the diseases should be in one basket, in one pool. So when we are advocating or when we're coming up with strategies for resource mobilization, we should be saying these resources, such a proportion goes to malaria, depending again on the priorities of those diseases, including the negligent tropical diseases. That's how I would answer this question. Thank you.
All right, thank you very much. So we have another question from Edel Sakwa. This will be answered by John Bauer, please. The question is, on funding to help fight malaria, how can we better allocate funding resources to research and development on new emerging technologies?
Yeah, thank you very much. So when we talk about funding for public health interventions, I think just as Dr. Temba said, the focus shouldn't just be on the disease. Of course, for the disease, we need to make sure that new and emerging technologies are all taken advantage of. And one of them is even this new malaria vaccine, which has come on as an additional tools. All these tools and interventions that are being utilized have all come about as a result of research. And research also requires investment. And I think it's important that African countries also take the lead in making sure that they make investment into research of diseases of concern in the continent. Most of the research that are being funded, even in Africa up to this point, are still donor dependent. And I think it's important that if we prioritize that these are diseases that are of interest to us, then we should also make the necessary investment into the research that is required. Because research builds capacity and also helps us identify new technologies that would even be much more adaptable within our settings. In that sense, we set the research questions, and then we also make sure that these are questions that reflect on the immediate and the future needs of our countries. We all know what happened even when the COVID pandemic hit. Because a lot of African countries have not built their research infrastructure, initially most countries were struggling to be able to even respond to the needs immediately, even when it came to testing. But for the few ones that already have some of these infrastructure in place, we saw the response rate. So I think we need to make sure that in as much as we are preparing to be able to invest in the interventions, the investment into research and preparedness, especially for a future pandemic, is very important. And so, of course, training and capacity building, and more especially making sure that resources goes into research is very vital. And this is where we need to also strengthen the collaboration with our corporate sector. A lot of corporate institutions do not have much more exposure about what they need to do and how they can help. And so that is where the advocacy bit also plays a critical role. I'm sure as we engage them, as we let them know the prioritization, and they also see the future savings and the impact on their health care costs, and also the general improvement in the health care of the populations which they serve. Because eventually, if you are looking at people to be able to demand for your inputs and your resources, and also the market that you want to create, if you do not have a healthy population, you will not be able to sell to this population. So if the corporate sector also sees that whatever investment they make in the health sector also brings them benefits directly and indirectly, I believe that they'll be ready to make that kind of investment in there. And once they can see some returns on the investment, why not? For them, they're always looking at how does this help me improve upon my efficiency and my profitability. And so if we can show them that evidence, and so that research will also include the cost effectiveness analysis, so as to be able to make sure that the corporate sector and all other partners who come on board will know that eventually this option is much more cost effective and also will be much more responsive to the populations that we serve, because they also want to become good corporate citizens. Thank you.
Thank you very much. We have another question. This will go to Obeta, and is a Nigerian-focused question. Mohammed Majia is asking why Nigerian youth malaria champion. Okay, why has a Nigerian youth malaria champion not been appointed? Not be appointed by the president.
Yes, thank you so much, Ms. Ojoma. That was a very fantastic question, and I'm glad that that question has come up on this forum. So, like I rightly said, I serve as the West African lead on the ALMA Youth Advisory Council, and part of the responsibilities assigned to us as a council of 11 members, made up of young people from about different African countries, is to see to it that we're able to develop the ALMA Youth Strategy. We're supporting the development of the ALMA Youth Strategy, which would help or guide the engagement of young people across Africa in the fight against malaria. One of the other responsibility as well is to help in the creation and the implementation of the National Malaria Youth Armies. This is a group of youth armies made up of young people that should be set up in every country in Africa to help, help the malaria fight in that particular country. And these youth armies are supposed to be integrated into already existing structure in different countries across Africa. Now, in Nigeria, for instance, Nigeria has one of the highest number of malaria youth armies across Africa. The ALMA Youth Advisory Council, while setting up youth armies, have received the highest number of applications from young people in Nigeria who are so passionate and want to really be a part of the malaria fight in Nigeria. We are currently in the phase of implementing or inaugurating national malaria youth armies across different countries in Africa. And already, as we speak, the first country that has had its national youth army launched is Kenya. And just recently, I was in a conversation with the coordinator of that particular youth army in Kenya, and I was just following up on some of the activities they've been doing in Kenya. And one of them is the fact that they've been able to increase community-led advocacy and research in Kenya. They've been able to promote uptake of the malaria vaccines in Kenya. They're producing a short film already, which is, I think they're done with that, to help increase awareness and advocacy in Kenya. Now, in Nigeria, what we're currently waiting for is for the National Malaria Elimination and Control Program, to approve the implementation and inauguration of these youth armies. And I'm so glad that the national coordinator is on this call as our keynote speaker. And then I believe she's going to maybe share a bit of more light on how much effort that the National Malaria Control Program is already making with respect to that. But I'm aware that ALMA is already making a lot of effort, and letters have been sent to this effect so that we can have the youth champions in Nigeria inaugurated, and then we can have them incorporated into the already existing malaria intervention structure in Nigeria. I am hopeful that we're able to hear from Dr. Perpetua on this issue, just to give clarity to the participants who have asked this question. Thank you so much, John.
John, I am muted.
Thank you very much, Obeta. We still have one more question in the chat box, but it's for Dr. Bauer. Yeah, the question is, given the baseline challenges like lack of technical capacity in Africa's low resource settings, where malaria is a big problem, how does Gavi intend to sustainably fund malaria vaccine development?
Okay, thank you very much.
Dr. Bauer, please.
Okay, thank you very much for the question. Yes, there is need for additional work on the malaria vaccine, because currently what we see are first generation malaria vaccines. And so there's additional ongoing research that has to be done to be able to come up with additional vaccines, the second generation malaria vaccines, which probably could even be, could be some improvement upon the current vaccines that we have, which probably could reduce the cost, the presentation, and even other forms in order to be able to ensure that they are much more cost efficient and adaptable within our settings. To be able to do this, yes, requires funding. And so that is why Gavi is looking at the partnership that it is having with countries. Of course, much of Gavi's investment in vaccines is not so much in the development phase, but it is more about trying to make sure that it improves access. And access here is trying to support countries that are Gavi eligible to be able to bring on board new vaccines, including the malaria vaccine, as early as possible to be able to make it available to the people who need it. However, Gavi also supports some minimal efforts across or around ongoing operational research, which countries might prioritize within their request that goes to Gavi. Gavi, however, also works with the global community and coordinates with other funders and donors to be able to make sure that these research and new findings that are ongoing becomes much more available. And so they do some complementarities around that. I must say that for the malaria vaccine, especially for the RTSS malaria vaccine, there was a great partnership that was made between African scientists. So African scientists really played a significant role in the development of the RTSS malaria vaccine. And I believe that that capacity that has been built can be leveraged upon for the development of second generation malaria vaccines that are still, for which discussions are ongoing, and some of them are even have already started. What is also required is that for African countries to also complement the efforts that other donors and funders will be making in this search. So I believe that if we go out there and we are ready to have a fruitful partnership and respectful partnership, and Africa is also committing to also make some efforts towards the research agenda, I believe Gavi and other partners would meet us halfway in order to ensure that we have additional malaria vaccines that will be able to make sure that it is quite cost effective and the vaccines are available to all children across Africa that would need it. Thank you.
Thank you very much. While speaking, Obeta asked Dr. Perpetual to make further comments on the issue of youth champions for malaria in Nigeria.
Like I mean, like he said, we're working on that. So the ALMA, African Leaders Malaria Alliance, is supporting the country to do that. So the plans are on, and you know, further information will come as things unfold. So that's the much I can say for that.
Thank you. So we'll now throw it to the audience. You can raise your hand if you have any question for the panelists or keynote speakers. Do we still have more questions from the audience?
Ajudo from AFIDEP speaking, for those who joined, and I introduced myself earlier. We don't have more questions from the audience, so we could go ahead to speak more on other webinars coming up. Thank you.
Okay, Adado, you have the floor. You can speak more on the other webinars coming up after this session. Before then, I want to thank the keynote speaker, the panelists, for all the in-depth information you've given about how Africa can invest more in malaria. Do I see a hand up?
It was a clap. It was a clap.
Okay. All right. Didn't see that well. Then there is a feedback form. It's in the chat box for everyone to fill. Please fill it before the end of the session. So once again, I want to thank the panelists for the in-depth information they've given towards sustainable financing and ensuring investment in malaria elimination and malaria control and elimination on the continent. With a huge burden of malaria the message you've resonated today on the need to do more, especially strengthening what we have and harnessing innovative financing mechanisms like taxes, the private sector, PPE, levies, and all that, and including a regional financing mechanism for long-term financing. Thank you very much. Once again, I'm Ojoma Ako, Health Editor, Daily Trust. It's been fun and interesting hosting this meeting. So Ada, you can give more information on the future webinars. Thank you.
Thank you so much. And apologies, Dr. Michael Katenge had his hand up. Sorry, I didn't see that earlier. So please, over to you, Dr. Michael.
Thank you very much for this wonderful webinar. I'm Michael Katende. I'm the regional coordinator for malaria in the East African community region. I hope you can hear me. This has been a very interesting webinar. I joined in when the keynote speaker was giving her presentation. To note actually is that I want to just comment that we need to ensure that we have more integration of our interventions, ensuring that malaria interventions are taken on board with other interventions so that we don't have malaria as a disease, but rather have integrated approaches. This will help to further increase on available financing and resources that can be used to respond to malaria. But I wanted to quickly ask a question to the colleague who presented on the vaccines. During his presentation, he mentioned that there are other available funding mechanisms for countries to access the malaria vaccine. Could you kindly expound more on this? Because this is very important. And I also was wondering, the criteria used, which is per capita. I was, as a lay, let me speak like on behalf of the lay people, I would assume that I would have loved to see the malaria vaccine more accessible to countries with a high burden of malaria. But the criteria seems to be looking elsewhere. Maybe you need to expound on this. Thank you very much for the wonderful presentations. That's all from me. Thank you. Over to you, Chairperson.
Okay. Thank you. Is Dr. Bauer still there?
Yes, please. Yes, please. Thank you very much. So, yes, thank you, Dr. Katenge. So, if you look at the per capita criteria, what that means is that it is the countries with the lowest per capita that gets the highest funding from Gavi. As I indicated, for countries that are initial self-financing, that's the countries with the lowest per capita, they just contribute about 20 cents per dose to the vaccine, whilst other countries that have got a higher per capita contribute more. So what it means is that the poorest countries get a significant chunk of the Gavi support as against the relatively richer countries. Then again, in terms of, yes, the malaria burden is one of the major criteria that is being used for access to the vaccines. I'm sure you are aware that currently there are limited supplies of the vaccines as against the demand. In fact, the current demand, so far about 28 countries have already submitted expression of interest to Gavi and WHO to introduce the malaria vaccine. The total demand by these countries is about 100 million doses annually, but we currently have just about 18 million doses. And so WHO, working together with Gavi and other key partners like the African Union and others, have set up a special process where they call it the Vaccine Allocation Committee, which has got some experts across the globe, especially from Africa, who then use some set criteria, which the major one is looking at the countries with the highest burden and where the impact will be most, to be able to ensure that there's equity in the allocation of the limited supplies that is available. So countries with the highest burden would be the highest need becomes one of the major criteria. And just as Dr. Perpetua also indicated, subnational tailoring then becomes quite important, so that even within the countries, whatever allocations that are made, the countries needs to also make sure that they deploy the vaccines to the areas within their countries with the highest burden or the highest needs for the highest impact to be made. However, it is important that continuous efforts are made to be able to make sure that we ramp up production. Because I think that with all this demand that has come, it's important that production also increases significantly. So efforts are actually underway to be able to ramp up production in order to be able to meet this expanding need or this high need for the vaccine as quickly as possible, so that every country's needs would be met appropriately. And that is why it is exciting that this other additional vaccine, the R21 vaccine, is also making a lot of headway, so that if it is able to go through the WHO pre-qualification, then it becomes an additional vaccine apart from the RTSS. And with its own additional volumes that would come, then it will mean accessibility to the vaccine to all persons in Africa who need it would be much more improved. So that maybe in the next 5 years to come, the issue of the vaccine availability probably would be a question of the past. And in order to ensure that Africa benefits significantly, that is why it is also important that efforts that are being coordinated by Africa and African countries towards the building the African vaccine manufacturing capacity would also look at making sure that some of these alliances and corporations are done, so that some of this technology for the development of the RTSS vaccine or the R21 vaccine could also become available in Africa in the nearest possible time, so as to ensure that production is ramped up. Currently, what the manufacturers of the RTSS vaccine have done is that they have gone into some technology transfer arrangement with some of the Indian manufacturers, that is Bharat Biotech of India, to be able to ensure that they also support, complement with their large production capacities to make sure that we have availability of supplies as quickly as possible. And once we have more vaccines available globally, we also believe that the cost per dose will also come down significantly. So affordability for all African countries and all populations in other parts of the world where falciparum malaria is a problem would also be improved, so that the complementarity of the malaria vaccine to existing tools can properly be enhanced. Thank you.
Thank you. Over to you, Ada Ujo.
Sorry, apologies for that. Let me share my screen to talk about the next few webinars I had shared earlier while Dr. Michael was talking, Michael Katende was talking. So we have, it's a webinar series which started on World Malaria Day in April. And we've had it every 2 weeks. As Ojoma had mentioned earlier, this is the third webinar in the series. And number 4 will focus on emerging health technologies. We would have more information on vaccines in that webinar, as well as other emerging technologies such as gene drives, monoclonal antibodies. Please join us June 6th. And then finally, we would end on June 20th with increasing research and capacity, which we've also talked about in this webinar as well. So thank you all so much for attending this webinar, and we look forward to seeing you in the next webinar and also the one following that, June 20th. Wish you a good day. Thank you.
Thank you very much. Yeah, bye now.
Bye. Thanks for having us.
Thank you, and bye, everyone.
Thank you so much, and have a good day.
Thank you. Bye.